In this video, we will talk about synopsis of psychiatry, behavioral sciences, or clinical psychiatry. We will talk about which topics, which contents are discussed in this book. Just let me show you this book. We will simply talk about the contents of this book, which topics have been discussed in this book, and just the names of the topics. Chapter 1, Neural Science. Introduction, functional neuroanatomy, neural development and neurogenesis, neurophysiology and neurochemistry, psychoneuro, endocrinology, immune system and central nervous system interactions, neurogenetics, applied electrophysiology, chronobiology. Chapter 2, contributions of the psychosocial sciences, JAR, Piaget and cognitive development, attachment theory, learning theory, biology of memory, normality, and mental health. Chapter 3, contributions of the socio-cultural sciences, sociology and etiology, transcultural psychiatry, culture-bound syndromes. Chapter 4, theories of personality and psychopathology. Sigmund Freud, founder of classic psychoanalysis, Eric H. Erikson, other psychodynamic schools, positive psychology. Chapter 5, examination and diagnosis of the psychiatric patient. Psychiatric interview, history and mental status examination. The psychiatric report and medical record. Psychiatric rating scales, clinical neuropsychology and intellectual assessment of adults. Personality assessment, adults and children. Neuropsychological and cognitive assessment of children. Medical assessment and laboratory testing in psychiatry. Neuroimaging, physical examination of the psychiatric patient. Chapter 6, classification in psychiatry. Chapter 7, schizophrenia spectrum, other psychotic disorders. Schizophrenia, schizoaffective disorder, schizophreniform disorder, delusional disorder, and shared psychotic disorder. Brief psychotic disorder, other psychotic disorders, and catatonia. Chapter 8, mood disorders, major depression and bipolar disorder, dysthymia and cyclothymia. Chapter 9, anxiety disorders, overview, panic disorder, agoraphobia, specific phobia, social anxiety disorder or social phobia, generalized anxiety disorder, other anxiety disorder. Chapter 10, obsessive compulsive disorder and related disorders. Obsessive compulsive disorder, body dysmorphic disorder, hoarding disorder, hair pulling disorder, or trichotillomania, excoriation or skin picking disorder. Chapter 11, trauma and stressor related disorders, post traumatic stress disorder and acute stress disorder, adjustment disorders. Chapter 12, dissociative disorders. Chapter psychosomatic medicine, introduction and overview, somatic symptom disorder, illness anxiety disorder, functional neurological syndrome disorder or conversion disorder, psychological factors affecting other medical conditions, uh, factitious disorder, pain disorder, consultation, liaison psychiatry. Chapter 14, chronic fatigue syndrome and fibromyalgia. Chapter 15, feeding and eating disorders, anorexia nervosa, bulimia nervosa, binge eating disorder and other eating disorders, obesity and metabolic syndrome. Chapter 16, normal sleep and sleep disorders, normal sleep, sleep-wake disorders. Chapter 17, human sexuality and sexual dysfunctions, normal sexuality, sexual dysfunctions, paraphilic disorders. Chapter 18, gender dysphoria. Chapter 19, disruptive impulse control and conduct disorders. Chapter 20, substance use and addictive disorders. Introduction and overview, alcohol-related disorders, caffeine-related disorders, cannabis-related disorders, hallucinogen-related disorders, inhalant-related disorders, opioid-related disorders, sedative, hypnotic, or anxiolytic-related disorders, stimulant-related disorders, tobacco-related disorders, anabolic, androgenic steroid abuse, other substance use and addictive disorders, gambling disorders. Chapter 21, neurocognitive disorders, introduction and overview, delirium, dementia, major neurocognitive disorder, major or minor neurocognitive disorder due to another medical condition, amnestic disorders, neurocognitive and other disorders due to a general medical condition, mild cognitive impairment. Chapter 22, personality disorders. Chapter 23, emergency psychiatric medicine, suicide, psychiatric emergencies in adults, psychiatric emergencies in children. Chapter 24, complementary and alternative medicine in psychiatry. Conditions that may be a focus of clinical attention. Chapter 26, physical and sexual abuse of adults. Chapter 27, psychiatry and reproductive medicine. Chapter 28, psychotherapies, psychoanalysis and psychoanalytic psychotherapy, brief psychodynamic psychotherapy, group psychotherapy, combined individual and group psychotherapy, and psychodrama, family therapy and couples therapy, dialectical behavior therapy, biofeedback, cognitive behavior therapy, hypnosis, interpersonal therapy, narrative psychotherapy, psychiatric rehabilitation, combined psychotherapy and pharmacology, genetic counseling, mentalization-based therapy, and mindfulness. Chapter 29, psychopharmacological treatment, general principles of psychopharmacology, medication-induced movement disorders, alpha-2 adrenergic receptor and agonist, alpha-1 adrenergic receptor antagonist, clonidine, guanfacine, prazosin, and yohimbine, beta-adrenergic receptor antagonist, anticholinergic agents, anticonvulsants, antihistamines, barbiturates, and similarly acting drugs, benzodiazepines and drugs acting on GABA receptors, bupropion, buspirone, calcium channel blockers, carbamazepine and oxcarbazepine, cholinesterase inhibitors and mematine, disulfiram and acamprosate, dopamine receptor agonist and precursors, dopamine receptor antagonist, first generation antipsychotics, lamotrigine, lithium, melatonin agonist, ramelteon and melatonin, diritazepine, monoamine oxidase inhibitors, nefazodone and trazodone, opioid receptor agonist, opioid receptor antagonist, naltrexone, nalmefene, and naloxone, phosphodiesterase 5 inhibitors, selective serotonin norepinephrine reuptake inhibitors, selective serotonin reuptake inhibitors, serotonin dopamine antagonist, and similarly acting drugs, second generation of atypical antipsychotics, stimulant drugs and atomoxetine, thyroid hormones, tricyclic and tetracyclics, valproate, nutritional supplements and medical foods, weight loss drugs. Chapter 30, brain stimulation methods, electroconvulsive therapy, other brain stimulation methods, neurosurgical treatments, and deep brain stimulation. Chapter 31, Child Psychiatry. Introduction, Infant, Child and Adolescent Development. Assessment, Examination, Psychological Testing, Intellectual Disability, Communication Disorders, Language Disorders, Speech Sound Disorder, Child Onset Fluency Disorder or stuttering, Social or Pragmatic Communication Disorder, Unspecified Communication Disorder, Autism Spectrum Disorder, Attention Deficit or Hyperactivity Disorder, Specific Learning Disorder, Motor Disorders, Developmental Coordination Disorder, Stereotypic Movement Disorder, Tourette's Disorder, Persistent or Chronic Motor or Vocal Tic Disorder. Uh, Chapter 31:9, Feeding and Eating Disorders of Infancy or Early Childhood. Pick up, rumination disorders, avoidant or restrictive food intake disorder, elimination disorders, encopresis, enuresis, trauma, and stress or related disorders in children, reactive attachment, trauma and stress or related disorders in children, reactive attachment disorders, and disinhibited social engagement disorder, post-traumatic stress disorder of infancy, childhood, and adolescence, mood disorders and suicide in children and adolescents, depressive disorders and suicide in children and adolescents, early onset bipolar disorder, disruptive mood dysregulation disorder, oppositional defiant disorder, conduct disorder, anxiety disorders of infancy, childhood, and adolescence. Separation anxiety disorder, generalized anxiety disorder, and social anxiety disorder or social phobia, selective mutism, obsessive compulsive disorder in childhood and adolescence, early onset schizophrenia, adolescent substance abuse, child psychiatry, other conditions, attenuated psychosis syndrome, academic problem, identity problem, psychiatric treatment of children and adolescents, individual psychotherapy, group psychotherapy, residential, day and hospital treatment, pharmacotherapy, psychiatric treatment of adolescents, child psychiatry, special areas of interest, forensic issues in child psychiatry, adoption and foster care, child maltreatment and neglect, impact of terrorism on children. Chapter 32, Adulthood. Chapter 33, Geriatric Psychiatry. Chapter 34, End of life issues, death, dying, bereavement, palliative care, euthanasia and physician assisted suicide. Chapter 35, Public Psychiatry. Chapter 36, Forensic Psychiatry and Ethics in Psychiatry. Forensic Psychiatry, Ethics in Psychiatry. What aspects of psychiatry? Glossary, signs and symptoms in psychiatry index. So that's all the contents of this book. I just talked about of all the contents that have been discussed in brief or elaborately in this chapter. I hope you have been able to know about how many psychological diseases or how many psychiatric diseases are there in psychiatry or behavioral science or clinical psychiatry. I think you have enjoyed listening to this video. Last of all, the regular thing that I always say is that only Facebook knowledge or YouTube knowledge will not help you to be a good citizen. You need to study regularly, and you need to keep a very good health, because health is wealth. For maintaining good health, you must have sound sleep of more than 7 hours to less than 9 hours. If you continue to do this, you will be a healthy person. A healthy person is a wealthy person, is a resource for the human society. So that's all about today's video, and I think you have enjoyed listening to these videos. And if you like these videos, you will, I hope, try to browse all other videos in my channel. And in my channel, all the videos are about educational purpose only. If you want to engage yourself in education, you can try to browse all other videos in my channel. Uh, the videos I make are not about any society or politics or anything else, but it's just only for educational purpose. Last of all, I'd like to thank you all who have been watching this live session at night. And lastly, wishing you a very good health and good knowledge. Uh, I wish you live a good life with good knowledge, good erudition, good pandit, good scholarship, and thank you for listening to this video. And lastly, I would like to say you goodbye. I hope you have enjoyed listening to this. Thank you very much. And in my next classes, I will try to talk about the psychiatric diseases from uh, from the perspective of a common man, because most of the people of Bangladesh psychologically remain undiagnosed. They don't like to go to psychiatrists because in Bangladesh people think that going to a psychiatrist is like being a mad or crazy totally. But this is not true. Anybody can have psychiatric problem. Anybody can have anxiety disorder. Anybody can have trauma. If you want to overcome these things, you must go and visit a psychiatrist. Thank you. Bye bye for listening to this video. Thank you very much.